Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender adult care. Welcome to my channel. If you have not yet had a chance to subscribe to my channel, I would very much appreciate if you do so. Not only are you helping everybody else find this content, but this is the best way you can show your appreciation and showcase your support toward my content. So I'd really appreciate if you do subscribe. Having said that, for today's video, I would like to talk to all of you trans femme identified who are suddenly might be experience an appearance of genital gender dysphoria. In other words, you may have felt neutral about your genitals. You may have felt like, I don't really like my genitals, but I don't really also at the same time hate them to the extent where I want to get genital surgery. You may have felt some mild dysphoria, but nothing that has warranted you to even think about potentially getting genital surgery. And now suddenly there is quite an increase, quite a distress, or just an element of awareness that you're having genital dysphoria at all, whereas in the past it was not. First of all, this is a very, very common experience. I can't tell you the number of trans femme clients that I worked with who have always felt a sense that, hey, Dr. Z, I don't think I'm going to get bottom surgery. I just don't really feel that distressed in that area. My genitals don't really seem to bother me that much. Does that sound like some part of your narrative? Or, hey, Dr. Z, I'm not that comfortable with my genitals, but it's really not that big of a deal. I am in a relationship and I'm totally fine using my genitals and I want to be sexually functional. That also could be part of your narrative. And then to suddenly experience genital dysphoria can be destabilizing, to say the least. It can be confusing and it can also shift the trajectory of your gender transition. Now, I also want to be very mindful to say that there's a lot of people who never do ever experience an increase in genital dysphoria at all, and who do continue living their life as women with their genitals without actually having through any kind of surgical modifications. That's also very, very probable and happens all of the time. So this just want to be very clear that just because you may even experience an increase in genital dysphoria, it doesn't necessarily mean you have to run for the surgery, unless, of course, it is something for you. But why is it that you may have started and you're going through maybe elements of gender transition and you never felt discomfort or felt discomfort but never had inclination to do anything about it? Suddenly the discomfort is getting higher. Suddenly it's getting to the point where you're becoming pretty consciously aware of genital dysphoria being present. Oftentimes, what happens, and this is a very, very common experience. What usually happens is that it's not that you never had genital dysphoria to begin with, is that you have genital dysphoria, but it is what I call in a state of dormancy. The same word that applies to volcano. When volcano is in a state of dormancy, it is asleep until one day it erupts. The same thing. Your feelings in regards to your genitals may be in a state of dormancy. In fact, you may have different state of dormancy in different aspects of your gender elements. And that can be really, really frustrating. Some people may feel gender dysphoria in all different areas of their physicality, and some people may just feel, for example, just their facial features and not feel it anywhere else. And so to suddenly start feeling it somewhere else can be confusing. This is again what I call dormancy effect. It's not that it's not there. It's there, but you're not in touch with that part of your body yet, or there's a deeper sense of denial or repression taking place, or maybe just some parts of our bodies are not that not that they're not significant, but maybe they're not as crucial to your evolution right now. For example, very, very common for trans women to first be incredibly preoccupied and focused and concerned with their face. Understandably so. Why? Again, your face is visible to everybody. And a lot of times it is the first thing that anybody sees. And because of the facial features, we in our cultures tend to be gendered immediately, left or right. So it makes complete sense that the first primary investment and focus of energy that a lot of trans women are going to make is toward feminizing their face. Genitals are not visible. They're only visible to you. And they're only visible to you in your privacy. They're only visible to you also when you go to the bathroom and activities that many of you might just be completely disconnected from or dissociated from, or during intimacy. Again, an activity during which a lot of you have learned to dissociate from because it makes you very hyper aware of your genitals. And so, because genitals are something that is not visible, a lot of people in the beginning either don't have any sense of genital dysphoria or have the dormancy effect where it's there, but you're not in touch with it yet. I also think that because genital surgery is a big surgery, and because there's so much myth and reality on internet from how incredibly full of complications the surgery is, that it's the most complicated surgery in the whole wide world, which it is not. Not to mention that out of all gender affirming surgeries, the one that is, I would say, has the higher potential complications is going to be phalloplasty for transmasculine individuals. So the myth ranges from you ruining your life if you're going to get genital surgery to it's the best thing in a whole wide world and it's you're going to have zero complication risks. There's almost like no consensus of reality. And so because it ranges so much, as human beings, it's natural for us to cling to elements of information that may be scarier than the one that is less scarier. And so a lot of you might be clinging to the information that this is such a big, scary surgery. This is such a big, important surgery. And if I screw this up, I screw up my life. People go through I had a patient who was getting ready for bottom surgery, and she had some people tell her, "You're gonna ruin your life. You're gonna be in diapers all of it." It's just horrible stuff. That's completely their fear mongering projected onto her. So the point I'm trying to make is that when you are terrified of the surgery to begin with, it's all further is going to keep your feelings about your genitals in a deeper dormancy state because you're not going to allow your mind to go there. You're not going to allow your mind to contemplate, to think about, to investigate, to evaluate how you feel about your genitals because you're afraid that if you do, then you're going to confront it, and that confrontation will lead to surgery. So the dormancy effect is one of the most important things that is accountable for why you may not have felt genital dysphoria, and then suddenly it comes up. The other one that is accountable for why you have never experienced genital dysphoria and how it suddenly comes up, or what accounts for the reason for it to suddenly to come up, is that as you are starting to evolve into your authentic selves, depending on your goals, and goes from hormonal to surgical to just overall presentation, as you start to get more and more aligned, as you start to see yourself more feminized, as you're starting to also, especially, and this is especially if you have of other parts of your body have drastically feminized, either you got breast augmentation or you achieved a good breast growth on hormones, As all of those things start to happen, suddenly genital dysphoria bubbles to the surface. Why? Because, my friends, it's easy to ignore genitals in the beginning when things are not yet fully aligned. It becomes that much more difficult to ignore genital dysphoria when you look at yourself in the mirror and you're scanning yourself from head, and it's almost like you're like putting mental check marks for yourself. Love my face, love my chest, love my stomach, my hips. And then you get to the genitals and you're like, it's like music stops. I'm horrible when it comes to mimicking any kind of music. But you get my point. And the reason why it stops, because our genitals are still parts of our body that is so highly gendered in our society and gendered in incredibly binary ways. And so, for that reason, it is very difficult to scan yourself and to feel aligned and then get to the genital region and still feel fine. And a lot of people feel fine, and that's great. But a lot, by far more people, don't feel fine. They start to feel discomfort because suddenly this part of their physicality, this gentle part that seemed to be neither here nor there in the past, are now suddenly doesn't fit with the picture. It's like you're looking at the puzzle and suddenly there's this big chunk part of the puzzle that you can tell belongs to a completely different puzzle set and doesn't belong here. And that's what wakes up genital dysphoria. That's when people suddenly say, you know what? Even though I still don't maybe feel strong sense of genital dysphoria, it just doesn't feel right anymore. It just irks me now. Especially by this point in gender transition, a lot of you are starting to socialize more. You are feeling more confident. You're feeling more assertive. You are forming social bonds. You're forming relationships. You're forming intimate relationships. Intimate relationships that require intimacy. Relationships that require being open and vulnerable. And that also puts more emphasis on genitals. So if you are suddenly experiencing either a drastic increase in genital dysphoria or just an awareness that now your genitals bothers you when never before you experience that, these are the most two common explanations why. It's always been there, you just never noticed because it's been in a state of dormancy. Or it's not that it's always been there, but as you become more aligned with yourself, now it's being there no longer makes you feel comfortable. Now it gives you dysphoria because now this body part is screams and being so presently more out of alignment with your whole self. Very, very common. Both of the scenarios, very common, happen a lot. When it happens, what do? You have to kind of decide for yourself what it means for you, what your sexual life is like. There's many elements to consider. Again, it doesn't mean you have to run to get genital surgery, but just understanding why you're suddenly feeling it all of a sudden can help you at least starting to understand what are those feelings are trying to tell you. Comment below, let me know if you have ever experienced a sudden, an onset, if you will, of genital dysphoria. And what did that communicate to you? What did you decide to do? What was it feeling like? And what ultimately was your decision? Comment below. Love reading all of your comments, and I will see you all next time. Goodbye.